My name is Claudia Wernick, and I'll be discussing the lead poisoning emergency in Zamfara State, Nigeria in March 2010. The objectives of this presentation are to understand what caused this unprecedented acute lead poisoning event, identify how it affected the most vulnerable population, children under 5, review remediation efforts, and explore public health outcomes. In this presentation, I will review the timeline of events, give a brief overview of Zamfara State and the local government areas that were the most affected with lead contamination as a result of artisanal gold mining, and explore the resulting health effects. In early 2010, a high number of children under age 5 became critically ill and also died. Doctors Without Borders, already working in Zamfara State, measured blood lead levels to determine the cause of death. Over 400 children, they determined, had died due to lead poisoning. Local and federal Nigerian agencies working with international resources started remediation efforts. They included chelation therapy for affected children, decontamination of the areas, isolating ore processing, outreach with education, monitoring, and implementing safety measures. Zamfara State is an agricultural state where farming is the main industry. In early 2010, gold prices rose quickly and significantly in international markets. This caused many to begin processing ore individually to try and capitalize on a new way to make a lot of money. As illegal mining became more popular, ducks suddenly disappeared from the areas, and reports of critically ill and dying children were reported. No reports before March 2010 were made of children suffering from lead poisoning. Artisanal gold mining refers to small-scale ore processing by untrained individuals who work with basic rudimentary tools. It is not regulated and practiced without safety measures. International agencies observe children participating in all stages of the mining process. Local ore contained a very high level of lead. The lead poisoning crisis occurred in northwest Nigeria, and more specifically in the local government areas of Anka and Bekuyum. Begega community is located in Anka, LGA. It's the largest and was the most contaminated village. It was known as the national hub for artisanal mining. This chart shows that among 158 households surveyed, 45 participated in ore processing. Almost all of these households processed ore within the home. The blood lead levels of 185 children were tested. 99% of these children had elevated blood lead levels, which is about 10 micrograms per deciliter, and 91% had severe lead poisoning, which occurs when blood lead levels are greater than 45 micrograms per deciliter. It should be noted that ore processing was commonly performed in communal areas just outside the home. Exposure to lead dust was everywhere. There were several pathways of exposure to lead contamination as a result of ore mining. Lead dust was released into the air and onto soil and clothing in the first phase, when the ore was crushed and ground. Children ingested lead dust through hand-to-mouth contact, as well as by inhaling the dust from the clothing that they and their family members wore. These artisanal miners did not remove and wash their dust-filled clothes before entering the home. Lead dust was spread to existing vegetation and onto soil through the sluicing process. Washing ore also transmitted lead to water sources. Since children absorb and store lead very easily, lead contamination had pronounced effects on their health. This chart shows recommendations by the U.S. EPA regarding lead contamination levels in soil. At about 450 parts per million, the EPA's guidance is that children should be kept out of the garden and certain vegetation shouldn't be grown. At 1,000 parts per million, the EPA's guidance is that no crop should be grown in the soil. Lead concentration levels in Zamfara State measured 100,000 parts per million. This chart shows lead levels in water in Bekega community were significantly higher in surface water, indicating that lead contamination came from an environmental source. It also demonstrates that lead levels were present in well and borehole water sources. The monthly crude mortality and lead poisoning rates in children under 5 were also measured. In April 2010, at the initial stages of testing, the 1-month crude mortality rate was 31 out of 1,000. In September 2010, the 6-month crude mortality rate was 75 out of 1,000, indicating a decrease in the monthly crude mortality rate. This is a result of the immediate and longer-term remediation efforts by local and federal Nigerian agencies working with international organizations. Those efforts included decontaminating the affected areas, chelation therapy for affected children, relocating ore processing activities, and storing ore away from homes, as well as adopting measures that reduce the release of lead dust. There also has been an ongoing education campaign to modify behaviors to increase adherence to a safer ore mining process. This chart shows that blood lead levels among children under 5 have steadily declined to much lower levels from May 2010 through December 2013. The remediation efforts have had a significant impact on the health outcomes of children under 5 in Zamfara state. Lead poisoning in Zamfara state was an unprecedented global crisis. Remediation efforts by Nigerian and international organizations drastically reduced the death rate among children under 5 within a matter of months. Last year, Doctors Without Borders reported that lead poisoning deaths in this population were virtually eliminated. Ongoing monitoring is required to ensure that safety protocols are maintained in Zamfara state. Thank you for watching this presentation.